Hello, everyone. So welcome to Cosmo Malayali show. Um, this is our fourth episode, and as usual, we kind of publish our episodes, our show on different platforms like Spotify, YouTube, Apple Podcasts, and the good news is Savita, my co-host, and I are happy that we are going to publish a Facebook page as well. So we've got a plenty of platforms to publish ourselves now. There are two things kind of maybe you just noticed just now. There are two things unique about this episode. So the first thing is the language. So the chat show Cosmo Malayali was kind of conceived in view of like catering to audiences who speak Malayalam. But obviously, the topic what we're going to deal with today, I think it will take more than a Malayali audience, and it will go further than Kerala and the Malayalis who live all over the world. So that's the reason why I am speaking in English. So I hope that I'll be as clear and coherent as possible, and we all will be clear as well in terms of our language. The second thing which is unique about this episode is the nature of the topic. So we've had 3 episodes before, and this episode, the 4th episode, is slightly in a serious or maybe a somber nature, because the topic is about organ donation after death. Now, the reason why we chose this was because death is something that is so inevitable. It is out without control. We cannot stop death. It will happen to all of us. But I think there are things that can make it very beautiful, a beautiful death, or something that is so powerful even after we die. And I think, or we all of us think, that organ donation is a very powerful way to show after we go away from the face of this earth. So for that reason, we have got our first host, my first guest, who is quite the apt person to talk about organ donation in our episode. So I have to introduce you Dr. Radha Sundaram. She is a consultant intensivist in the west of Scotland, in the United Kingdom. She's an awareness champion for organ donation. In addition to that, she's also the regional advisor for intensive care medicine training in the west of Scotland as well. So welcome, Radha.
Thank you, Nitin, and thank you, Savita. Thank you for inviting me.
Pleasure.
So, Radha, so obviously, I'm sure you will have some conflicts of interest with this, as clearly stated.
Yes, thank you, Nitin. So, as you rightly pointed out, I'm a consultant in intensive care in hospital in the west of Scotland in the United Kingdom. And as an intensive care consultant, I have the privilege of looking after people when they're on life support. I also have the unique privilege of approaching families about the decisions that their relatives may have made in health about organ donation. And if the relative had made the decision to proceed with donation after their death and the family agree, it is definitely a privilege for us to facilitate that. And as you rightly said, make something beautiful from death, save 8 lives, help in building a legacy for the dying person. My conflict of interest is that this is my job. I also have been promoting awareness about organ donation for the last 10 years. And I have another conflict of interest, which I will reveal at the end of the show.
Okay. So, no, thank you, Radha. So the other thing is I do have a conflict of interest to declare as well, because my daytime work is as a consultant anesthetist. I'm a consultant neuroanesthetist. I do work in intensive care as well, and I do occasionally facilitate organ donation after death as well. So that is my conflict of interest. What about you, Savitha?
So, me being a dentist, I don't think there's any conflict of interest as far as I'm concerned. And I'm quite ignorant about this topic, to be honest. So, to put that in simple terms, organ donation would be the process of surgically removing an organ from somebody and putting it into another person, isn't it? So, what's the usual process that happens in UK? Would you elaborate on that, please?
So we're talking about deceased donations, a donation that happens after death. When patients are admitted to intensive care for life-saving treatment, only patients on life support can actually donate their solid organs, such as their kidney and their liver and their heart, because they need to be on life support. We try to save their lives, but sometimes, and I'm happy to say that it's in a very small number of cases, we reach a point of futility where we cannot save their lives. At that stage, we ask the family whether the patient who's now on life support and cannot really tell us, we ask them whether that patient has expressed a wish to donate in health. Now, we all know that when we go and register at a GP in the United Kingdom, or when we apply for a driving license, we are asked if we would like to donate. And actually, the public in the UK are very supportive of donation, and over 80% of the public will actually receive a transplant if they need one and support donation. In Scotland, over 50% have actually registered their wishes by going on the organ donor register. If we find out from the family that that patient would like to donate, we then, the conversation happens in the presence of a specialist nurse in organ donation, who's a nurse who works with our intensive care unit. And along with them, we then approach the family and actually explain to them the process of donation. The patient continues to receive the same care that they have been receiving up until then. Nothing changes. Care doesn't stop. Treatment doesn't stop. We then have to get a lot of personal information about the patient. The specialist nurse in organ donation helps the family gather all that information. They then have to actually contact various transplant units in the country. And they have a very, very clever process where they match the organ based on patients who are waiting for transplants in various parts of the country, their urgency, their age, and their need for this organ. And then they actually do what they call a sharing, where they actually start matching the organs. So at that time, they will know that maybe a patient in Birmingham is waiting for a life-saving liver transplant. That patient will be invited to come to hospital that day. They will find out that they'll be able to donate the kidney in Glasgow, and a patient will get that much awaited call to actually come to the hospital that day. And again, this process can take up to about 24 hours, the gathering of the information and the retrieval team coming. The retrieval team is a group of very skilled surgeons who operate all over Scotland. Sometimes we also have teams coming from Northern Ireland or Newcastle, and then they come to the unit, speak to the family again, go through a process where they check everything, and then actually the patient is taken to theatre just like they would be having an operation in health, and the organs are retrieved with dignity, and there is no question of mutilation. It's done just like an operation, just like your gallbladder comes out when you're healthy. The same way these organs are removed. The patient is then returned back to the unit for the family to actually say their goodbyes. Most often, though, we find families say their goodbyes before the patient goes to theatre for the retrieval operation, and often go home. They then receive a call to say that the retrieval has been done successfully. These organs are then flown in aeroplanes, most often, unless they're being transplanted in the same city, to various destinations just to give the chance of life, most often to 8 other people if they donate all organs. If you've ever traveled in a BA flight, sometimes you would have noticed in the last seat, there is actually a red sort of box, and which will say fragile, handle with care, and will have the NHS blood and transplant logo. It's often the life-saving organ that's actually going to be transplanted in someone far away.
Yeah, now that's impressive, isn't it? So the amount of resources, the amount of coordination, the amount of teamwork that takes for all this to happen within a short span of time, that is incredible, isn't it?
Yes.
Can I ask, Radha, so basically, when you say organs, just for the information of the listeners, what sort of organs can a person donate after death?
A person can donate all their solid organs, which are their heart, their 2 kidneys, their liver, and sometimes the liver can actually be given to 2 patients. It can be one lobe can be given to one patient and another.
That's good.
Their 2 lungs, their pancreas for diabetic patients, that can be life-saving, their intestine. So I think I've done kidneys, lungs, liver, heart, and pancreas, and sometimes the small intestine as well.
Oh, right. Okay. And you did say that, that the patients should be on life support systems. So does that mean that the patient has to be, or the patient has to be in an intensive care setting?
So fortunately or unfortunately, if we die at home or we die in an uncontrolled manner anywhere else, even if our wishes were to donate, we would not be able to proceed with solid organ donation. You have to be on life support because we need to keep the organs in a viable condition so that we can actually give the transplant recipients a chance at life. These organs, once we die, start decaying very, very quickly. And it's important that we actually support that with our life support to be able to actually make a difference to the recipients who get these life-saving transplants.
So at that point, you're definitely looking at preserving the organs as much as possible in the best conditions.
Yes.
Okay. So is there a cost involved, or does the recipient, does the donor's family or donor get any money, or is there any cost involved in this process for the recipient?
So I think the UK is very unique in that there is no cost involved. It is just the gift of life that a dying patient's family are giving to other people. As the NHS is a socialist model, the patient is not, the recipients are not charged, and the donors, apart from getting the heartfelt thanks of their recipients and actually being recognized in an award ceremony every year and getting a recognition from the Queen, and in Scotland, in Holyrood Palace as well, they don't actually get any money at all. And that's what makes it so unique, so altruistic, and so powerful.
So is there an age limit to donating the organs?
There is no age limit, and we ask everyone to make a decision about donation regardless of their age. The medical frontiers are constantly being pushed, and the age limits that were there 10 years ago have been pushed further because of increasing life expectancy, and also because we're able to keep these organs in better condition. There are some specific age limits for the heart and for the liver, but certainly kidneys have been transplanted from patients well into their late 70s and early 80s.
Okay. You mentioned earlier about the recipient has to match the donor. So could you elaborate on that? Like what happens? How do they match the tissues?
So patients, when they receive an organ from another person, their body will reject it because it's a foreign object. And therefore, we need to make sure that they actually accept it. And they have found that if you're from the same blood group, there is a greater tendency for you to accept the transplanted organ. And if they also do tissue typing as well, so in the lab they're able to actually go through a lot of tests to make sure that you have the same sort of tissue types that will make it more likely that you'll accept the organs. Patients who receive transplants have to be on a lifetime of anti-rejection drugs, though. But with good matched organs, the amount of anti-rejection drugs that they need to take, or the type of anti-rejection drugs, might be less. And that makes their sort of quality of life after they get the transplant also better.
That's interesting. I'm sure there are some interesting statistics about the rate of donation and all that implications with the society, which I think is a very important message that should be spread out to all communities actually. Could you go into there's the numbers and the figures we have about organ donation and transplantation?
Yeah, so every day, 3 people on a transplant waiting list die because they have not received the organ that they so badly need.
Every day.
Every day.
Right.
Currently, there are 6,000 people waiting for a life-saving transplant in the UK. I think up to April 22, we've done about 1,000 transplants. That is a combination of both living and deceased transplants, but it's woefully short of where we need to be. And the gap between the number of people who need transplants and the number of transplants that actually happen is still quite big. Mm-hmm. We are 5 times more likely to need a transplant than ever be in a position to donate, because only 1% of deaths can actually proceed to donation. So it is likely that we will know more people in society who have received transplants, who are waiting for a transplant, than people who donate, just because of that statistics. In terms of, I don't know if you want me to go into specifics about ethnicity.
Yes, of course, that'll be interesting to know.
Touch on the ethnicity, because we are kind of focusing on a certain, South Asian, a small group of ethnic minorities here as well.
So I think the data on ethnicity will be very, very interesting to know.
Very relevant to this topic.
So 30% of the transplant waiting lists are represented by South Asians and Blacks. This is because hypertension and diabetes are more common in South Asian and Black populations. So we're more likely to get organ failure, and the sort of organ failure that we get can only be sorted by a transplant. That certainly is true for kidney transplants. If you look at the current census population statistics for the UK, in 2011, we estimated that 14% of the UK population were from Black and ethnic minority. But it's 2022 now, and as we know, there has been a lot of migration, so we think it's far higher than that. But if you look at the number of people who've actually proceeded to donation from Black and ethnic minorities, it's less than 7%. And that figure is not increasing. What that means is because better matches come from the same ethnicity, because certain blood types are more common in certain ethnicities. The negative blood types are more common in the African continent and the Indian subcontinent. And if you were to receive, your best match would be, if you were a negative blood group, so B negative, the chances are that your best match would be a B negative organ from a B negative patient. And therefore, you get a better match if you get it from your own ethnicity. It is not to say that you cannot accept an organ from another ethnicity. And the chances are, given that we actually transplant very few organs from South Asians and Blacks, that most South Asians and Blacks who have received transplants in the last 5 years have organs from white, very, very generous families, white people in them. This statistics is very, very sobering, and it has a tangible impact on our populations, because if you're Black or South Asian, you have to wait a year longer for a kidney transplant.
Okay. So you mentioned about the situation in UK at the moment. So what's happening with other countries then?
So the UK is definitely got, perhaps, and Nitin and I would be very biased here because we work here, but has one of I'm sorry to use Boris Johnson's term, but it does have a world-beating donation and transplantation service. We have a completely coordinated, unified service that works all across the UK, which is NHS Blood and Transplant. If you look at America, they have a very positive attitude towards donation and transplantation, but it's devolved to the various states and is done by independent agencies. It's not by one coordinated state agency at all. Spain has the best donation and transplantation rates in the world, and they have a system very similar to the UK, but not quite like the UK. And they have an opt-out system that the UK has moved to now. India is still in the process of actually establishing it. In India, there is more sort of donation of corneas for restoring sight. India has actually got a very, very good system for that. But donation of deceased organs is still not as coordinated as it could be, but there are lots of agencies working towards it.
Interesting. And I also understand there's a religious aspect to this as well. So if someone's looking to wanting more clarification on this, where would you look for?
So you're right. I'll quickly touch on the religious aspect. Death, as Nitin pointed out at the start, is inevitable, but it's a very important event. It's perhaps the only certain event, and therefore scriptures from all religions have written a lot about it. And there are some processes that are very unique to each religion at end of life. When we have done our work in Scotland, increasing awareness about organ donation amongst ethnic communities, what we find is there are no barriers against donation. People are not wanting not to donate. They do wish to donate. What they find really difficult is to try and navigate their end-of-life processes during this period of grief. Because for the Muslims and the Jewish people, they have to do their burial rites within 24 hours. If we then go and say, we have to proceed with it, you've agreed to donation, but it's going to take more than 24 hours, they feel very conflicted at that point, because they're not able to secure for their dying relative the blessings of their elders, of their God. And so that is what causes the conflict. There is in a lot of information.
It's a kind of practical difficulty, isn't it?
Yes. We have worked very hard with NHSBT now to make sure that when you register your decision to donate, there is a column that says, tick this if your faith and your culture matter to you. And if you tick that box, the specialist nurse in organ donation already knows that you are perhaps from a faith or culture that may have some unique needs at end of life. And we can then actually coordinate with a hospital chaplain or a chaplain from that faith to help the family navigate that process. But the NHS organ donation website and Organ Donation Scotland website have faith and religion sections with every religion's sort of view on donation sort of described in that. But no religion actually says no to donation, because when our scriptures were written, it was thousands of years ago, and organ donation wasn't even on the radar of people who wrote those scriptures or discussed those scriptures. However, giving, generosity, donation is a part of every religion, and it only is rewarded and encouraged.
That's nice. So what happened recently was that one of my family friends passed away, and one of his dying wishes was to donate his body to teaching hospitals for medical students. However, what happened was when he passed away, the hospital authorities realized that he was not registered with the Organ Donation Society, and he hadn't mentioned it in his will as well. So there was some disagreement amongst the family members, and finally it just didn't happen. So my question is it important to register yourself with the Organ Donation Society? And should you be mentioning it in your will, and should the family be united with, should you mention it to your spouse and your close family members?
You're so right, because when we are in the position where we are going to be, our family is going to be approached about donation, we are in no fit state to actually give consent ourselves. So the campaign for Scotland this year is leave them certain and leave them in no doubt. So if you wish to donate, and by no means are we saying that everybody should wish to donate, but if those are your views, then please discuss them with your families. And we have found that families that have already discussed this feel empowered at a time of great grief to actually say yes. If you have registered and your family are uncomfortable or tentative about proceeding, we do remind them that you have actually expressed a wish, but we do not overrule the family's wishes. And there's a lot of debate about this, even though the UK has moved to an opt-out system. In May 2020, England moved to an opt-out system, Scotland in March 2021, and Wales in 2015, we still ask the family. And the reason why, and Nitin will be able to confirm this, the reason why we do not proceed if the family say no is because they're the ones who have to survive the grief. They are the survivors, and it's our duty to look after them. And if they are against it, we can't put them through the torture of actually agreeing to a process that they feel uncomfortable about. And so we do not actually force that at all. So yes, my urge to all listeners is, if you wish to donate, please register on the NHS organ donation website, and do let your family members know, so that you can give them the courage to make the right decision for yourself when that time comes. And I hope that the time doesn't come, really, for most of us.
That's interesting. So yeah, and I think it's interesting you brought up the opt-out law as well, which brings me to talk about the real life incident about Kira and Max. Would you kindly tell us about that story?
Yeah. So there has been huge public support for the opt-out law, but what has helped is actually the work of two families. So Kira Ball was a little girl, she was 9, and she was in a road traffic collision, and she was on life support. Her family found the courage to say yes to donation when their little precious girl was on life support. Her heart was transplanted into a little boy's body, Max Johnson, and both Kira Ball and Max Johnson's families lobbied very hard for the law to change from an opt-in to an opt-out law. It actually came about with a private member's bill in the parliament, and most private members' bills actually don't gain any traction, but it was a private member's bill by a Labour politician during Theresa May's government that actually gained traction, and it then became a piece of legislation. In Wales, the law changed in 2015, and they saw an increase in families saying yes to donation from 47% to over 70%.
Oh, wow.
A huge rise.
That's impressive. Wow. Cool. So I think that's a load of information that you have given us. Thank you very much, Radha. So I think what we will do is we will post the information and resources about what you've mentioned on our YouTube channel, and also on the podcast sites as well. But before that, let me just remind all the listeners and the viewers as well, because the day after we're going to publish this episode on organ donation, it is the World Organ Donation Day on the 13th of August. And in addition to that, the NHS is campaigning for organ donation in September, from the 19th of September to the 25th. So you have a lot of information available. And I think we have discussed a great topic, and it's a very impactful topic to the society as well. Absolutely. And please follow our channel, and just click on the bell icon so that you can get the notifications when new episodes come through as well. Savita.
So thank you so much, Radha, for accepting our invitation and providing us with such an informative talk on organ donation after death. So as they say, it takes lives to save lives, isn't it? So friends, please click on the links below to gain more information on this topic, and please put in your valuable feedback as well. So thank you so much, and see you all soon.
Thank you, and goodbye.
Bye.
Thank you for listening to our guest, Dr. Radha Sundaram, and us in this episode. Dr. Radha Sundaram has conveyed to us that she's more than happy for us to tell her story in relation to organ donation. I'm going to read out her own story, which will be a befitting afterword for this episode. She says, "Without organ donation, I would not be the doctor I am today. A few years ago, my eyesight began to fail. I was told that if I do not receive corneal transplants, my vision would gradually worsen. In 2015, I received my sight-saving transplants, thanks to the generosity of 2 brave families. To this day, I owe them so much."